New and alarming coronavirus variant with an unusually high number of mutations.
Researchers say it could be the most infectious form of the virus so far
and better able to evade vaccines.
The WHO says that the new strain presents a very high global risk.
The Omicron variant has once again put the focus back on vaccinations. Governments across the world are racing to vaccinate their population. This over fears that the new variant may potentially be more resistant to vaccines. In India, there are now demands for a booster shot. States like Karnataka have asked the union government's permission to administer a third dose of the COVID-19 vaccine. But should India really be giving a booster shot when a majority of its adult population is yet to be fully vaccinated? What should India's vaccination strategy be amid concerns over the new variant? I'll get you these answers. But first, a quick reminder that stories like this take time, effort, and resources. We cannot do this without your support. So do become a member of the News Minute community by clicking on the link in the description below. And don't forget to subscribe to our YouTube channel. Now, the debate over a booster shot isn't really new. After all, a number of countries, including the US and Canada, are providing a booster shot for all adults 6 months after they get their second shot. In fact, the UK, which has been offering a booster shot to those above the age of 40, has now opened it up to all adults above the age of 18. What's more, it's also revised the gap between the second dose and the booster, shortening it from 6 months to 3 months, amid concerns of the Omicron variant. But what's the scientific evidence behind a booster dose? So several studies have suggested that immunity wanes after 6 months. Israel, which was the first country to roll out boosters back in July, provided some real-world lessons. A study conducted in Israel found that those who had received a third dose of the vaccine had a 93% lower risk of hospitalization, a 92% reduced risk of severe disease, and an 81% lower risk of death due to COVID-19. This when compared to individuals who had received only 2 doses of the vaccine 5 months before. So should India follow much of the Western world in giving a booster dose of the COVID-19 vaccine amid global concern over Omicron? I spoke to 2 doctors who said that a booster shot may be needed, but not everyone requires the third shot.
It should be given to highly vulnerable. Who are highly vulnerable people? Those who are above 60 years. And more importantly, those who are immunocompromised.
Most of the South African cases have been young people. What happens if the more vulnerable elderly or those who are immunocompromised get this particular variant as their infectious agent? We do not yet know. But we have to proceed on the assumption that people who are vulnerable because of age, debilitating medical conditions, or immunocompromised state are indeed more likely to be vulnerable and they need additional protection. And healthcare workers and other essential workers who were immunized very early in 2021 and whose immunity might be fading at this point in time or might have already faded are people again who need additional protection. Because even if the virus is causing relatively mild illness in most people, people like health workers are repetitively exposed to high viral loads, and therefore their vulnerability is higher.
But a booster dose may not be the immediate priority, even for the vulnerable. Remember, India hasn't fully vaccinated its adults. Only around 40% have received both doses. And unlike many countries, India hasn't even begun vaccinating its children. So what should our strategy be?
The government at the moment is looking at the policy of prioritizing the first dose vaccination being completed to cover all adult population, completing the second dose vaccination as the next priority, and then looking at booster doses for people who are immunocompromised or otherwise vulnerable, and then looking at child vaccination. This is obviously a sequential affair based on the supply side situation of the vaccines. I believe a certain amount of review is called for. When this review will take place at the governmental level is partly dependent on the state of science and the level of evidence that is available within India of mounting infection rates and the clinical effects thereof, and of the supply side situation of the vaccine.
And although there is fear over the Omicron variant and the fact that it may potentially reduce the vaccine efficacy, let's not forget that nearly 70% of India's population above the age of 6 has been exposed to COVID-19. This is according to India's Sero survey that was carried out after the second wave.
In our country, we are having hybrid immunity to sizable number of population. For example, what people say is around 70% of India's population has been already infected during the Delta variant. Following that, around 70 to 80% has got at least one dose of vaccine. Eligible population has got one dose of vaccine. So this gives them hybrid immunity, which is much more potent than 2 doses of vaccine.
So our priority needs to be fully vaccinating our adults. But that's not the only reason why booster shots need to be limited to the vulnerable and our frontline workers for now. There are also moral and ethical concerns over giving a booster shot, especially when many low and middle income countries are struggling to administer the first dose.
One thing which is very clear is unless everybody is safe on this earth, nobody is safe. That has to be very clear. Until we have to distribute vaccine to a sizable population of the world, especially low income countries and middle income countries, especially of Africa and those countries, there can be further mutations which are happening.
If you look at what the vaccine manufacturers, particularly of the mRNA vaccines and other vaccines, are saying at the moment, Pfizer, Moderna, and so on, they are saying that we will be able to supply the world with adequate doses in the second half of 2022. Which is quite a long way off. In the meanwhile, the high-income countries and vaccine-rich countries are going to be saturating their populations with boosters. And if one more variant comes in, they will tweak their vaccines and again administer a fresh round of vaccines. And that is going to really disadvantage most other parts of the world. And variants will continue to emerge from under-vaccinated populations. So this business of prioritizing one's own population to the almost near exclusion of other populations is going to be counterproductive even for the vaccine-rich countries.
And yes, although the fears of the new variant are real, experts say that India's vaccination policy must not be driven by panic, but by science.